Hi, I'm Dr. Katie Findlay, Medical Director of Infection Prevention at Western Wisconsin Health. We have some important updates to share with you about influenza-like illness and how it is impacting our community. The U.S. continues to see rising rates of influenza-like illness, and our region of the state is seeing high levels compared to any historical baseline. Influenza-like illnesses include the three main viruses that you hear about frequently: COVID-19, influenza, and RSV, as well as various other pathogens that can cause cold and flu-like illnesses. The most widely circulating strain of COVID-19, JN1, seems to be easily transmitted, but existing vaccines, tests, and treatments continue to work well against JN1. If you contract COVID-19, talk to your provider about what treatments would be right for you. Influenza affects our region each year at this time, and the vaccine for this year is a good match for what is circulating in the community. RSV used to be thought of as an infection of small children, but it also disproportionately affects older adults. Fortunately, vaccine has been released this year to protect that population from RSV as well. There are a variety of other pathogens, such as viruses and bacteria, that can cause influenza-like illness as well, and we know that these are circulating heavily in the community as well, even if we don't directly identify them. As the rates of these illnesses rise, we are seeing significant strain on the healthcare system in our region. As such, Western Wisconsin Health has taken some steps to protect the patients who are seeking care, as well as our staff, so that we can continue to care for our community. We hope that you will stay well during this time. It's important to maintain a healthy lifestyle with good nutrition, regular activity, good sleep, and positive relationships, so that if you do become ill, your body has the best chance of fighting the infection. We have excellent vaccines against COVID-19, influenza, and RSV, and it's not too late to get this year's dose if you haven't already. Mom has always been right, and we should continue with the common sense things that she taught us, like washing our hands, covering our cough and sneeze. Also, remember that increased space and ventilation, as well as masking, can help decrease your risk of getting or spreading influenza-like illnesses. Finally, if you do become ill, please stay home until you are fever-free for 24 hours. This gives your body the ability to focus on fighting infection and also protects our community. If you test positive for COVID-19, the CDC Isolation and Exposure Calculator is an excellent resource to help you understand the steps you can take to protect the community. If you become ill, Western Wisconsin Health is here for you. Our priorities during this time are to ensure the safety of our patients and staff and to maintain appropriate staffing and equipment levels to care for the community. In order to protect our patients and staff, Western Wisconsin Health employees are wearing masks at this time, and we ask you to do the same if you come into the clinic or hospital. Staff is also working hard to mitigate the risks related to the high rates of influenza-like illness by using new workflows in some areas. These may be a bit confusing, but we are doing this to provide the safest setting for our patients. In order to ensure that you can access the care you need, we've taken the following steps. 1, increase same-day availability with primary care providers. We respect the relationship that you have with your primary care provider and want to ensure that you can see them when you need to. 2, we've increased coverage in urgent care. If you do not have a primary care provider or cannot get in to see them, our urgent care is available 7 a.m. to 7 p.m. Monday through Friday and 8 a.m. to 2 p.m. on Saturday. The urgent care and primary care teams are working hard to make sure that everyone is able to be seen in a timely fashion and that our ER remains available for emergencies. If you are having difficulty breathing that limits you from walking around the house or talking in complete sentences, please proceed to the ER, which is available 24/7. Western Wisconsin Health remains committed to ensuring that our community has the care they need for a healthy new year.